Well, welcome back. And throughout the month of May, BronxNet is celebrating National Nurses Month, highlighting VNSNY nurses who actually serve the community in different kinds of ways. Now, the coronavirus pandemic highlighted the vital role home care nurses play in recovery, but their job duties also range from educating and implementing healthy restrictions to wound care, as well as recovery. Our next guest has worked with VNSNY Home Care Bronx branch for almost 17 years. Joining us now to tell a little bit more details is the registered nurse at VNSNY Bronx Home Care, Cleo Miller. And Cleo, good to have you here.
Hi, good morning. How are you?
I'm good, fine, thank you. And congratulations. I should say National Nurses Month, so we want to say congratulations to you. And also,
Thank you.
Yeah, thanks. And you're welcome, I should say. Give me an opportunity to ask you about nurses, particularly in the area of surgery. We have a lot of patients who go out for outpatient surgery, coming back from inpatient surgery, and yet and still it requires a nurse to be able to take care of those people afterwards. Talk to us a little bit about the work that you do post-surgery.
Okay, so post-surgery, it depends on an orthopedic or, well, we have different types of surgery, but recently we've been getting a lot of hip and knee and back surgeries. Patients that were holding off from the pandemic from last year, we're seeing a lot of them now. And basically we want to keep these patients safe at home. That's always the goal. So we have a variety of patients. A knee surgery patient coming home to, let's say, a private home where they've lived all their lives and they were comfortable going up and down the stairs. And here it is, they come home from surgery and they cannot make it up the stairs. So we have to make sure they have all their equipment in place. We have to make sure they know that they're taking their pain medications on time so that they're not in pain. So we teach pain management. We have to teach them how to avoid wound infection. We have to teach them how to avoid blood clots, teach them how to avoid having the wound reopen, any sort of wound complications. We also teach them diet, because usually these patients have other comorbidities, might be arthritis, might be high blood pressure, might be diabetes, and diet is usually a big component of this.
Yeah. And so
go ahead.
When we talk about educating a patient, very important to make sure that patient is educated when they get home. So, and when you say talk about, how is that education process?
So as soon as you walk to the door, you start assessing the patient. So you see what the needs are as soon as you get to the door. It might be the patient took a long time to get to the door, so the patient is home alone. So you want to talk about or teach about safety, what their needs are. Are they going to be able to cook a meal for themselves? Are they going to be able to even wash up by themselves? And so we just basically assess their needs at the beginning, and then we teach them how to stay home in their home safely.
Are you noticing any trends that you're seeing in patients nowadays post-COVID?
I think there was a backlog on a lot of things. Not just surgeries. We have a lot of cancer patients who are not able to go for their treatments or to get whatever surgery they needed to correct that cancer. So it's not just orthopedic surgery, but there is, in the neighborhood where I work in the Northeast Bronx and over in Woodlawn and that area. And I have been seeing an increase in the types of surgeries I'm talking about, the back, the knee, the hip. And I had a patient recently who she was healing and forgot to tell us that she slipped while she was in the bathroom, and that wound opened up in her back. So this wound that would have been closed 3 weeks ago is now going to be requiring nursing care for another 6 weeks to perform wound care. As well as we have to encourage her to do her physical therapy exercises. If she doesn't do the exercises, then she won't heal as fast as she would like to and get back to her independence, which is her goal, to get back to full independence. So it's a gamut of things. It's a interdisciplinary approach. You have to coordinate with the physical therapist, you have to coordinate with the caregivers, you have to coordinate with the insurance companies, you have to coordinate with getting wound care supplies for her. It's a big thing.
Share with me a little bit about being an advocate for your patients. I mean, and what you're talking about, getting those supplies and doing those things. That's a form of advocacy, but talk to me a little bit more
Yes,
about being an
that's a
advocate.
big component of home care nursing. Last year, in the height of the pandemic, the disaster, um, I had a patient who was living at home alone. He's retired. His brother, his main caregiver who lived someplace else, came down with COVID. His sister, who lived in another area, also came down with COVID, and sadly, she passed away. And then his brother-in-law, who would come by to help, he ended up having COVID. So in addition to him having to deal with having lost his toe, he was a diabetic, so he had an amputation. So in addition to having to deal with the loss of his toe and to deal with me coming there to perform wound care and just the whole, everything that was going on, he developed an extreme case of anxiety to the point where he kept falling at home. He was very unsafe at home by himself. So we arranged for him to get a home health aide, but that was not enough for 24 hours. It was only for a few hours during the day. And he just kept falling, and it was very unsafe for him. And we tried to get him to go to the hospital, but at that time they were not really admitting patients, if it wasn't an urgent emergency. So eventually he fell one time too many, and he called 911, and they actually took him to the hospital. And while he was there, I was able to call the emergency room doctor and speak to them and let them know how unsafe it is at home for this man. And, that I understand that this pandemic is going on, but he really is not a safe candidate to be home alone. And the doctor was willing enough to listen to me, listen to my concerns, and listen to what the patient needed, and was able to facilitate helping getting this patient into a nursing home during the time when patients were not really going to nursing homes. He went to the nursing home and he stayed there, and he actually recovered. He got stronger, and he was able to come home a few months later, much calmer, and we're able to service him and help him heal. And at the end of the discharge, when I got ready to discharge him, he actually cried tears. He said, we helped him so much just to get his life back together and a peace of mind. And that was a good thing.
Well, congratulations for the work that you do, and thank you for the work that you do, really being an advocate and a supporter. We celebrate you during National Nurses Month. Cleo Miller, thank you so much for being with us here on Open.
And thank you so much for having me.
Well, Cleo Miller, thank you for the work that you do, VNSNY Nurse. All righty, well, for more information, you can visit their website at vnsny.org or call them at 1-800-675-0391. Again, that number, 1-800-675-0391. Now, we encourage you, don't go anywhere. We've got more Open coming up right after this.